Today's public service announcement is in regards to osteoporosis. It may seem like a concern to worry about as you reach old age, but it is very important to start caring about it now itself in order to quickly prevent the damage that it does to our bones. So what is osteoporosis? Osteoporosis is a disease that results in the loss of density within our bones. While we're young, our bones are stronger due to the frequency of bone cell turnover that exists to replace old bone cells. As we age, our bones become more and more fragile, causing them to become very weak and brittle. So, any simple movement can cause bones to crack or even completely break. Although it is something more frequently persisting within the elderly population, it is very possible for people of all ages to acquire this disease. So how relevant is osteoporosis in Canada? Osteoporosis is very common in Canada. It's a common cause of disability and it contributes tremendously to healthcare costs as well as premature deaths in Canada. According to the 2009 Canadian Community Health Survey, the Public Health Agency of Canada estimated that approximately 1.5 million of Canadians aged 40 and over have osteoporosis. Not only is this disease very prominent in Canada, it's far more prevalent in females than it is in males. Of the 1.5 million Canadians that had osteoporosis in 2009, women were more likely to report having osteoporosis than men. This is due to the fact that women generally don't have as much bone density as men do, and therefore they lose bone mass much quicker than men do as they age. After looking at Canada's statistics for osteoporosis, you may be wondering how big of a disease is this on a worldwide scale? Now, when we examine the prevalence of osteoporosis on a worldwide scale, osteoporosis causes more than 8.9 million fractures annually. This means that every 3 seconds of the day, someone experiences an osteoporotic fracture. As mentioned earlier, osteoporosis is far more prevalent in women than it is in men. Globally, osteoporosis is estimated to affect 200 million women worldwide. Approximately 1/10 of women aged 60, 1/5 of women aged 70, 2/5 of women aged 80, and 2/3 of women aged 90. Back in 2000, there were an estimated 9 million new osteoporotic fractures, which were prominently located at the hip, forearm, or they were clinical vertebral fractures, and it has been predicted that by 2050, the worldwide incidence of hip fracture is projected to increase by 310% for men and 240% for women. This indicates just how prominent of a disease that osteoporosis really is. Now, what can we do on our part to make sure that we won't experience the severe effects of this illness? The smartest approach is to detect earlier on for signs of developing osteoporosis. So how can you know if you have osteoporosis? You can tell if you may be en route to developing osteoporosis in many ways. One of the ways you could detect osteoporosis is if you notice that the bone cells in your jaw are beginning to diminish. Another sign of osteoporosis development in women is commonly observed in postmenopausal women. Research has indicated that postmenopausal women's bone mineral density weakens over time, which can lead to the weakening of their hand grip strength. This can be very dangerous as having a weakened hand grip strength can result in many dangerous accidents, such as losing grip of a railing and falling from dangerous heights, or dropping dangerous objects that can harm you. Another sign that you may be developing osteoporosis is seen when there is a loss in the strength of your nails, loss of your height due to compression fractures on your spine, bad posture, or back and neck pain. All of these signs help to point towards you developing osteoporosis in the future, or if you already may have osteoporosis. So what are some risk factors for having osteoporosis? There are some non-modifiable risk factors for osteoporosis, such as having personal history of fracturing as an adult, history of bone fracturing in close relatives, old age, having dementia, poor health, fragility, and oftentimes being of Caucasian descent can put you at more risk for developing osteoporosis. Not to worry though, there are some modifiable risk factors for reversing or at least slowing down your development of osteoporosis, such as being wary of your diet. The more nutritious your diet is, the more likely that your bones would be stronger. This means that limiting our intake of junk food not only helps us with our weight and overall health, but helps our bones as well. It's important to also limit our intake of alcohol and smoking. Excessive alcohol consumption can stunt the growth of our bone-forming cells, which helps to regulate our calcium metabolism and poor nutritional status. This means that drinking alcohol could limit our body's ability to absorb calcium and vitamin D, which is also very important for the health of our bones. Poor nutritional absorption also ties in with our physical activity levels. Only eating nutritiously wouldn't be enough to maintain the health of our bones. Therefore, we should make sure to incorporate exercise into our lives as well to ensure that our bones don't become weak from an overly sedentary lifestyle. This can be easily achieved by making sure to get an adequate amount of walking every day. It's recommended that walking for 30 to 45 minutes every day can ensure good health overall. Lastly, a very important risk factor that can contribute to the development of osteoporosis is having an eating disorder. Eating disorders such as anorexia nervosa and bulimia leads to oestrogen deficiency in women, which is the lack of estrogen. Having a lack of estrogen speeds up bone loss and wears down bone mineral density that is important to have during adolescence and early adulthood. If any of these risk factors resonate with you, it's important that you work towards bettering your health and lifestyle in order to avoid the chances of developing osteoporosis. So what are some preventative strategies for detecting osteoporosis? As mentioned earlier, there are many risk factors for having or being en route to developing osteoporosis, and the following is a recap of all those risk factors along with some new ones and their respective stages of preventative strategies. Primary prevention is the act of preventing a disease or illness from developing before its health effects even occur. In the case of osteoporosis, that would be being abstinent from alcohol and smoking, incorporating regular exercise to your life, eating a healthy and nutritious diet, getting a required intake of calcium, and getting a required intake of vitamin D. Secondary prevention is the act of figuring out if you already have a disease or illness and preventing it from getting any worse. In the case of osteoporosis, you should avoid medications that may increase bone loss, such as glucocorticoid medications, heparin, which is an anticoagulant medication used to prevent and treat abnormal blood clotting, anti-epileptic drugs, and aromatase inhibitors for the treatment of breast cancer. Another thing that could be done during the secondary prevention stages of osteoporosis is screening. You could do a bone density test to predict your risk of getting a fracture within the next 10 years and work towards reversing the possibility of it even occurring. The last preventative strategy is tertiary prevention. Tertiary prevention is when you're already confirmed for having the illness or disease and must work on bettering your lifestyle so it does no more further damage to your health. In the case of osteoporosis, you can work on reducing the damages done to your body by limiting alcohol intake, participating in smoking cessation, regular exercise, improving your diet, and getting professional care if you may deal with any eating disorders in order to care for your bone health. I hope this information has been beneficial to you and helped you to better understand the causes and effects of osteoporosis while giving you an adequate amount of information to help you better your own lifestyle or the lifestyle of a loved one who may or may not have osteoporosis. Thank you for watching.